Welcome back. Dr. Ibrahim with Orange Park Medical Center joins us to talk about AFib. He's also associated with First Coast Cardiovascular Institute. We're talking about AFib today, and Laura Zook is also here. She is with Orange Park Medical Center to discuss what the problem is and what can be done about it. So thank you both for coming in today.
Thank you for having us.
What is AFib?
AFib is irregular heartbeats coming from the top chamber of the heart. The top chamber fibrillates, the bottom chamber responds in fast and irregular fashion. This kind of behavior gives the classical symptoms of AFib usually.
So that may, I guess, to a person at home or to the patient, they would feel what, an irregular pounding, is that right?
That's true. Irregular sensation in the heart as well, like what we call palpitations, sometimes shortness of breath, fatigue, weakness, not having enough energy. And the most feared complication of AFib that we usually fear is stroke risk.
Wow, and that's something that I didn't know. One sometimes would think that it might lead to a heart attack, not stroke. How is that connected with stroke?
Well, you know, when you have irregular heartbeats, the top chamber doesn't squeeze the blood, so blood gets stuck there and goes to the brain, causing strokes. We know from previous studies that the AFib by itself can increase stroke risk by about 5 times. And this is why the management of stroke in AFib patients comes into place with blood thinners for patients with AFib.
Right, to be able to, you know, I guess, ward it off before it becomes a problem. Is that what you see, Laura?
Yeah, sometimes patients won't even know that they have AFib until they've had an event such as a stroke where maybe they're presenting to the emergency room and we're having to backtrack and find out why a patient had a stroke. Sometimes with AFib, with the symptoms that patients have, palpitations, shortness of breath, fatigue like he was talking about, they can just follow up in the primary care physician or come see their cardiologist and find out what's going on before they have to present to the AFib.
And as we look at that graphic right there, I guess that is the normal heartbeat, and then underneath is the AFib, so it's just a more erratic heartbeat?
It's more erratic and it's faster. You see that the top is slower and nice. The bottom one appears to be faster and irregular. And this is why you get these symptoms of irregularity in the chest.
Is there any particular age that this starts to appear more than others?
That's true. If you take a look at patients more than 70 years of age, about 10 to 15% of them will have AFib. Now, if you have family history of AFib, doesn't mean that you need to wait until you're 70 years of age. You might have AFib earlier in life.
If someone has AFib, would they know it? Wouldn't they feel the palpitations? Sometimes it feels like your chest is beating really hard, or would it go unnoticed, potentially?
Well, not usually. This is why sometimes actually patients, Laura knows, come to Orange Park Medical Center having stroke. You do EKG, you find AFib. And this is why, you know, these kind of patients, when they come to Orange Park Medical Center, we're very careful. We have certain protocols for these patients to follow in terms of treatment, so we can provide the best care for them.
And you mentioned the causes, maybe stress. Are there any other causes for someone to have or present with AFib?
As we mentioned before, age is really the #1. Now, any kind of heart disease can give you AFib, from blockages in the heart arteries to hypertension to heart failure, leaky valves. And actually, in some patients as well, when they have lung disease, for instance, they might have AFib as well. Hypertension is very, very commonly found in atrial fibrillation patients.
Right. And you would agree with that in terms of what you see?
Absolutely.
What do you tell them when they come in and they're asking you those questions? What do I do? What do you say to them?
There's a lot of treatment options out there, and most of them are discussed with the cardiologist and the patient. There's anywhere in treatment from medication treatment to electrophysiology studies and ablations, and then there's also devices that we can implant in patients that can help track that arrhythmia if we're unable to capture it on an EKG at that time.
And what are those treatment options?
Well, the treatment options, I always, when I have one of my patients coming with atrial fibrillation, I always tell them 3 arms of treatment. #1 is really stroke reduction by giving blood thinners. Aspirin, Plavix are not going to work. You have to have stronger blood thinners, such as Coumadin, warfarin, or the newer blood thinners. And medications are not that effective in terms of treating the heart rhythm. The effectiveness of medications is about 30 to 40%. They have a lot of side effects, and they have a lot of interactions with other medications as well. Now, the ablation part is the newest part of treatment, is the most effective one.
Okay, and I want to ask you, what is the difference between the abolition is what you're talking about, and the radio frequency?
Well, in terms of ablation, actually we have a diagram about that.
Okay.
In terms of ablation, we have two options. We have the radiofrequency or the heat energy, where you target the areas responsible for AFib with heat energy. And this is the diagram that you can see there.
So you're targeting this with heat. That's the
exactly
heat that's going in. Okay.
Like 4-millimeter catheter, you ablate these certain areas with heat energy. Usually this procedure takes about 4 hours, sometimes 5 hours. The newest technology, you know, in medicine we always say that in general, actually, newer is better, safer and most effective. And with this kind of technology, it's balloon angioplasty. It's actually balloon cryoablation. With this cryo balloon, you decrease temperature to minus 40 degrees, and that will burn with cold the areas that are responsible for AFib. Now, the crucial part that this technology is very new, and actually we have it now at Orange Park Medical Center. We started doing that for the last few weeks. The effectiveness, actually, the results are spectacular in terms of effectiveness and safety. The beauty about these procedures, they take about an hour to 1 hour and 15 minutes. They are safer and as effective at the heat energy. Now, not every patient is eligible. This is why we have both at Orange Park Medical Center. We use the radiofrequency energy, heat energy for some patient population, and now recently we started introducing this cryoablation or cold energy with, again, spectacular results.
Which brings us to our last question that I know is very important for you guys to make sure that we get across today, and that is how much does Orange Park Medical Center stand out when we're talking about heart disease, AFib? We should think Orange Park because you guys have all of these techniques there, correct, Laura?
Absolutely. We want the community to know that Orange Park Medical Center is a top performer in many of the heart and cardiovascular categories. We were just recently featured in the Best Hospitals edition of 2016 edition for U.S. News and World Report. And we were in Florida. We had the highest number of awards received from the American Heart Association targeting areas of stroke, heart failure, and resuscitation.
Excellent.
And we expect to hear this month as well that we'll be receiving another top quality performance recognition for our atrial fib care.
You're doing it right there.
So we always tell our patients that, you know, the best, the up-to-date, the standard of care, actually the state-of-art treatment is available at Orange Park Medical Center. You really don't need to go anywhere else.
Okay. All right. Listen, thank you both for coming in. Very valuable information. Interesting.
Thank you for having us.
Thank you.
Thank you very much.
And we'll be right back.